DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Folks, thanks for tuning in today to Doc Talk. I'm Dr. Dan Thompson. Today we're going to have a great show. We're going to talk about small ruminants, sheep, goats with Dr. Pippa Gibbons at Texas Tech's School of Veterinary Medicine in Amarillo, Texas. Stay tuned. This is going to be a great show.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thompson. I'm here with Dr. Pippa Gibbons. She is an associate professor of food animal medicine and surgery at the School of Veterinary Medicine at Texas Tech University. And your specialty is small ruminants.
Yes, sir.
And, we do so much stuff on beef. We do so much stuff, basically, if it's bovine central on our show and veterinary medicine. However, we're seeing more and more people ask us questions on small ruminants, and they're getting into the small ruminant business because land space, capital outlay, all the above, right?
Absolutely.
What a great time to have a visit and sit down. And from what I see at Texas Tech, y'all have got the right vision and just moving things forward. So thank you so much for being here.
Well, you're welcome. I'm glad to be here.
Great. So maybe just give us an overview of how in a sheep production unit would a veterinarian be used, or how should they be used? What are the opportunities?
Yeah, veterinarians are being traditionally used in like that fire brigade emergency. I have a problem lambing, I got lame sheep, sick sheep. But really, I mean, the sheep market and the goat market is really good right now. And there's some big challenges that producers have. And one of those is access to drugs, antibiotics, analgesics, so pain control. And traditionally people think, well, sheep just curl up and die in a corner. And I believe that I think we can do a lot for our sheep, and we need to give them good pain control, and appropriate medication. And so that starts with having access to a veterinarian. And that starts with that valid client-patient relationship, that VCPR. Yeah. And so having the veterinarian on your ranch or operation just to visit about herd health and herd management. So when I'm on a farm, a small ruminant operation, we talk about parasite control is the big one.
Yeah.
But vaccines, touch on nutrition, and just like in the beef world, a small ruminant veterinarian can help that produces, economics, like where are you marketing and how can we help you get there? Is it a nutrition issue, a disease issue? How can we help you achieve your production goals?
I wonder, like preventative medicine and having the ability to be on the farm on a regular basis has to be an advantage in any kind of production animal system, including sheep.
Absolutely. Yeah, there's differences between the way we manage beef cattle and sheep and goats, but the role of the veterinarian is quite similar most of the time.
So if you were going to lay out kind of like we talked about parasitology, but your top issues as far as health go, is it similar to cattle, like lameness and respiratory disease and some of these issues?
And sheep and goat production is widely variable, right? Mm-hmm. In terms of whether you're running an extensive meat production operation. Dairy goats is very unique and specialized, very much like dairy cattle. Right. And then we have a lot of small producers. So people with 10, 20, maybe 50 head max on small acreage. So parasite control's an issue, but also pregnancy diagnosis. That's something that the veterinarian can help you with. So dealing and linking in that nutrition, preventing pregnancy toxemia, identifying abortion issues. So that's something that I do frequently is pregnancy diagnosis.
Perfect. Well, we do have a lot of crossover, but let's take a break.
Yep.
When we come back, we'll do more here with Dr. Pippa Gibbons at Texas Tech School of Veterinary Medicine. Thank you.
I'm Dr. Julia Herman, the beef cattle specialist veterinarian with NCBA. Cattle producers have an entire resource team that's really important to taking care of their cattle, and the veterinarian is an integral piece to that. Veterinarians can help with your herd health planning, so that includes vaccine planning, maybe it's breeding season, adjusting your breeding season, working with your nutrition plan, but there are other things that veterinarians can help you with. Treatment protocols, diagnosis protocols, biosecurity planning, emergency action planning. Veterinarians are really a key resource for all producers and on all different operations. I encourage you all to utilize that veterinarian client-patient relationship. Strong relationship with your veterinarian is so important.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Pippa Gibbons. She is an associate professor in food animal medicine and surgery at Texas Tech's School of Veterinary Medicine, focusing on small ruminants. And you know, as we left, we have the crossover, but you know, whenever you think sheep and goats and paddocks, you think parasites.
Yes.
And so
Parasites,
that's
number
a
one
big deal.
cause of death and illness in sheep and goats.
All right. So kind of give us some, you know, what are some of the things that are similar? What are some of the things that are different? But maybe just talk about parasites and sheep and goat production in general.
Yeah, so most of the parasites that we are most concerned about will be our strongyle type. So that's not dissimilar to beef cattle.
Right.
We have our parasites that cause diarrhea and weight loss, like our osteotagia. And then we have homuncus that cause the barber pole worm that causes anemia, weight loss, and death. And all of them cause production losses before they get to like the fatal signs. And the biggest difference really, although it's becoming more common in beef cattle, is that we have a lot of drug resistance to our dewormers, to our anthelmintics.
Right.
And so the whole ethos around small ruminant parasite control is this concept of sustainable parasite control. We know we have resistance. We can't really prevent it. How do we manage it, delay it, without overusing the drugs?
Right.
And we're seeing some of that in beef cattle in heavy areas where there's a lot of grass in certain areas of the country. So there's some similarities there.
And so are you, I mean, are you similar as the beef world of having, you know, 3 or 4 classes of compound as well?
Yeah.
And so how do you manage that and kind of give us an overview of what if you're walking into my place and I had a sheep flock, what would be your, hey, this is what we need to do, Dan?
Yeah, so really sustainable parasite control, there's this concept of refugia, and refugia is the part of the worm population that isn't exposed to the drugs. And so that's either worms in animals, sheep and goats that are untreated, so you choose not to deworm them because they don't need it, or it's the part of the worm population, the larvae, that live on the pasture. So we don't want to routinely deworm anymore. We're moving towards what's called targeted deworming, just identifying those animals that need it. And we use like FAMACHA, body condition scoring, the 5-point, depending on what parasite you're targeting. And don't deworm during a drought or periods when there's no worm population on the pasture. So we just dilute out the natural resistance with the non-exposed worm population.
So can it get pretty regimented? Like we can get a calendar set up and like farmer rancher working with the veterinarian, just kind of have this set up, and do you pick a certain subset each year that don't get dewormed, or how do you
It depends on the size of the operation. For smaller operations where you can handle the animals on a regular basis, we really focus on targeted treatment. So you look at those individual animals and identify the ones that need to be treated. When we're talking about extensively raised animals, you might elect to treat a subsect on a regular basis, because running 1,000 animals through a chute every 2 months is just not labor sensible. So
Right.
it depends a little on the size of the operation.
Okay. Well, so then you would run some through and deworm them while the others are not, and then the next one is another period, another subset. That's a very interesting concept, and something I'm sure the viewers are going to pick up on. But let's take a break. When we come back, we're going to talk more about small ruminant management, health, and more with Dr. Pippa Gibbons.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Pippa Gibbons, and we're in Amarillo, where Dr. Gibbons is the Associate Professor of Food Animal Medicine and Surgery at the Texas Tech School of Veterinary Medicine. What a beautiful facility y'all have.
Thank you. It is. It's great to be here and to teach in this facility.
Yeah, well, and we've met your faculty, we've met your students. The mission is just phenomenal, and you have such a culture here. It really helps me be excited more and more about what's coming in the veterinary profession. So thanks for all you're doing. Let's talk about pregnancy in sheep. And so when do we pregnancy diagnose, and what's the gestation length, and just some of the basics that some of the people out there would be interested in learning?
Yeah, so the gestation length is about 150 days. Sheep are just a couple of days shorter. And pregnancy diagnosis is really important for management, and especially nutrition. There's a disease called pregnancy toxemia or twin lamb disease, where if they have either too thin or usually over fat, and have multiple fetuses, they just can't eat enough and they become really sick. And it's a cause of death, lamb loss, loss of production. And so by pregnancy diagnosing, we can identify those ewes that are pregnant. And so again, just like cattle, you can get rid of the open ones.
Yeah.
But secondly, how many fetuses they're carrying. And so that's a difference between beef, is we're really interested in these singles or multiples.
Right.
And in that time, it's a great time to body condition score the animal as well. And so you can sort them into different pastures or housing, depending on the operation, and feed them accordingly, because sheep and goats that have multiple fetuses have quite a bit higher energy needs than the singles. And so you can tailor your nutrition. And by knowing those animals, just like in cattle that are pregnant, you're able to to better quantify what your abortion percentage is, if any, what your lambing percentage is. And again, that from a marketing production perspective, that's important to know how many lambs you're going to be expecting.
Sure. And I'm going to assume that there's different causes of abortion at different stages of pregnancy. And so, between breeding and pregnancy testing, and in between pregnancy diagnosis and lambing, there are different causes. What are some of those?
Yeah, so just we have infectious and non-infectious. And the key in small ruminants is most of the infectious causes are zoonotic, so they can be transmitted to humans. So that's a big risk for small ruminant producers. Things like toxoplasmosis, chlamydia, those are probably the most common cause of infectious abortion, but there are non-infectious as well. And so submitting samples, which includes placenta and the fetus, to the diagnostic lab is really key to identify what's going on.
Outside of the infectious ones, what are some of the non-infectious causes?
A lot of it can be stress and trauma. So dog chasing, predator attacks, nutritional causes. And unfortunately, a lot of the times the non-infectious ones, we don't really get a diagnosis on.
Oh, right.
So we don't really know as
kind of just a rule out. No, nothing cultured or isolated. So
correct.
Yeah. Perfect.
Yeah.
Well, let's take a break and let's come back to this topic and talk about kind of the interactions and how we can prevent or decrease abortion rates in sheep.
Sounds good.
Thanks. You're watching DocTalk. We'll be right back.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Pippa Gibbons. We're at Texas Tech's School of Veterinary Medicine here in Amarillo. Dr. Gibbons is a small ruminant veterinarian by specialty and teaches here as an associate professor of food and animal medicine and surgery, and just been a great day.
Good. I'm glad you've enjoyed your day.
Thank you for all your hospitality here at Texas Tech. But we're talking about sheep.
Yes, sir.
So tell us about, we talk about biosecurity in cattle all the time.
Yeah.
What are some of the things that you coach clients on biosecurity in their sheep flocks?
Yeah, so there's a lot of similarities to cattle. So when you think about biosecurity, we want to think about animals that are moving on to the holding onto the operation. And we also want to think about neighboring animals, potentially wildlife that traverse across pastures. So when we buy, a lot of people are expanding their sheep operations, they're buying in animals. And so that's a really key time to be aware of what diseases are out there that you don't want to buy in. And some of them are the same as in cattle. So Johne's disease. The challenge with Johne's disease in small ruminants is it doesn't cause diarrhea until the very end. So it's just a skinny animal.
Yeah.
So most people think it's got parasites or it's nutritional. It's also much harder to test and be accurate in the testing. So there are tests for it. That's something to talk to your veterinarian about. But Johne's is a big one. Buying in, we talked earlier about parasites. So buying in animals that are healthy and they're not bringing multi-drug resistant parasites with them. Foot rot, infectious foot rot, we see a lot of in wet areas particularly. Caseous lymphadenitis, the infection that goes to the abscesses in the lymph nodes. Obviously, the one thing that I talk to clients about is sort of the checks that you want to do. Are these animals sound at walking? Obviously, if you're buying males, are they fertile? So getting a breeding soundness exam, just the same as in bulls. We really caution against buying pregnant animals because you don't know what they could be harboring. They could abort and later, even though they're infected earlier. And so quarantining newborn animals is really important. Making sure that the animals you buy are the correct age. So we can age sheep pretty reliably up to age 4 with their teeth, and goats as well. Checking their lymph nodes in front of the shoulder, underneath the jaw for any evidence of abscesses or scarring from ruptured abscesses. And then, as I said, you could test for Johne's disease with the blood or feces. You can test for diseases like ovine progressive pneumonia, which actually doesn't cause pneumonia as much as it causes a mastitis, and lambs starve because there's no milk. So several diseases that you can test for on a blood test.
So then when we're doing a quarantine or whatever, so you can shorten that up with diagnostics, right? If there's a certain bug that you want to make sure they're clear of, or we can wait a certain amount of time period. What are some of the recommendations that you would make?
Yeah, for quarantine, somewhere between 21 and 30 days. About 30 days is ideal. And ideally you want those animals in an area away from the main flock. You want to handle them last, just in case there is something that pops up. And in that time, you can do any diagnostic testing that you need to.
So we've got about 30 seconds to wrap up here. What would be your advice to sheep producers, just working with a veterinarian and that in general?
Yeah, so reach out, find a veterinarian that will be willing to work with you in your sheep or goat operation. Extension agents are another great resource. And if you don't know a veterinarian, the extension agent probably does know of a veterinarian who is willing to work with you. And think about being proactive and setting up and talking to the vet or to get a management program going before any problems occur.
It's great. It's always better to prevent.
Yes, sir.
Thank you so much.
You're welcome. Thank you.
And thank you for watching DocTalk. Remember, if you want to find us on the web, you can go to www.doctalktv.com. Always work with your local practitioner. I'm Dr. Dan Thompson with Dr. Pippa Gibbons at Texas Tech University, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
I'm Sydney Tuckwiller. I'm a territory manager with Neogen, and today we're going to be talking about the value of genomics. Genomics is a tool in cattle production and management designed to help make breeding decisions to support herd health and performance. Through studying genetic markers in DNA, producers can utilize this technology to reduce risk, increase efficiency, and add value to an operation. Genetic potential for maternal, production, and carcass traits can be determined at an early age instead of having to wait for extended periods of time to show in their progeny. Collecting this information can help producers make management decisions sooner for their herd to achieve faster genetic progress, including selecting replacement heifers and producing feeder cattle that fit their market. Using genomics allows us to measure our overall herd strengths and weaknesses, as well as on an individual basis to define breeding objectives and make more precise pairings. The ability to determine which cattle make up the bottom 25% of the genetics in a herd can help determine culling criteria, while identifying the top 25% can help to recognize the leading genetics. Once producers are able to point out where areas of improvement are desired and which cattle they are keeping, there becomes more clarity on which bulls are needed to complement the genetics that have already been implemented into a cow herd. By being able to better pair sires with females, we are optimizing the investment into bulls selected and driving genetic progress in the desired direction. Additionally, genomic testing can be used to verify parentage and observe sire groups, as well as the ability to manage unwanted recessive genetic traits. Using genomics can be customized to operations of all sizes in different parts of the country to help cattle producers' success for generations to come.
Thanks for watching Cattle Intel by Neogen.